So as we have entered the small intestine, so the main artery that was supplying the midgut was our superior mesenteric artery. So that was supplying the midgut, and as we know the whole extent of the midgut, so we can easily see what were the branches. So here if we make the duodenum continue into jejunum, and then we have this jejunum and appendix cecum and ascending and proximal 2/3 of transverse colon. And if we look at the root of misentry, then the root of misentry was from the DJ flexure to the right sacroiliac joint. So this length of the root of misentry is just a 15 centimeter. So it is just like 15 centimeter of the root of misentry, and you have the whole length of jejunum and ileum, which is being controlled by this root of misentry, not just jejunum ileum but also the part of the cecum ascending colon in the proximal 2/3, because everything here in the midgut is being passing through this root of misentry, and for the transverse colon we have the transverse mesocolon. So it is just like you fly a kite, so you have a small string which is connected to the the kite over there, and the kite is huge and you have a small string. So the small string, compare it with the root of misentry, and the whole loops of intestine are huge compared with the kite. So through this the double layered fold of root of misentry passes the superior mesenteric artery and its branches. Same, the veins will go and the lymphatics and nerves will also pass through that. So this is our midgut. So what will the branches which will come from the superior mesenteric artery? First of all, it will supply the distal half of the second part of duodenum, third part duodenum, by giving the inferior pancreatico-duodenal artery. So the lower part of pancreas as well as the final parts of the duodenum will be supplied by this. Then it will give off the jejunal branches, the ileal branches, and then this jejunal ileal will supply the jejunum ileum. Then it will also give off a ileocolic, a right colic and a middle colic. So these are your A, B and C. A is your ileocolic artery, and this ileocolic artery, its descending branch gives off the appendicular artery. B is your right colic artery. It will mainly supply the ascending colon and the parts related to it. And C is your middle colic artery, that will supply the proximal 2/3 of the transverse colon, and all these will form the arterial arcades that we just discussed. And all these arterial arcades, they form around the colon part as the marginal artery of Drummond. They are known as the marginal artery of Drummond. So up till the proximal 2/3 of transverse colon, these will be the branches of the superior mesenteric artery. Then we have the inferior mesenteric artery which will supply the hindgut. So if we include the inferior mesenteric artery also over here only, then come to this part. If we write about the inferior mesenteric artery, that is the artery of our hindgut. So if we continue the gut from the proximal 2/3, distal 1/3, descending sigmoid, rectum and anal canal, then these inferior mesenteric artery, if we take supposedly the green color to represent the other branches, then this inferior mesenteric artery will also give 3 major branches, which again if we label as A, B and C, then A will be your left colic artery, B will be your sigmoid colic artery, and C is going to the upper part of rectum. We call it as the superior rectal artery. These are all asked in your exams. So where does the superior mesenteric artery and the inferior mesenteric artery, the anastomose? The final branch of the superior mesenteric artery, the C over here, was our middle colic branch of SMA, and the left colic, the branch of IMA. The anastomose somewhere around the splenic flexure of colon. This will be the splenic flexure of colon. So at the splenic flexure of colon, the SMA and the IMA, those branches, the anastomose, and it is also comparatively a less vascular compared to the others. So in addition to the marginal artery of Drummond, which was forming the arterial arcades throughout the colon, we have an extra arterial arc of riolan, RIOLAN, that supports that area around the splenic flexure of colon to supplement the artery supplied that area. So these are the three branches of inferior mesenteric and those branches of superior mesenteric. So these supply all the parts of the midgut and the hindgut. On the next figure we will see over here the appendix part and the artery over here. So this over here is our ileocolic artery, correctly written over here, the ileocolic, which was a branch from the SMA, superior mesenteric artery. And then you will see that a descending branch from the ileocolic, this particular over here, is giving off the appendicular artery, which runs over the margin of the misentry of appendix. This runs on the margins of the misentry of appendix and it supplies the appendix. Now this appendicular artery which is supplying the appendix is an example of the functionally it is an end artery. So if there is